Let's get to it. This time, all reason, no rhyme, we promise. It appears we have a visitor who's come to tell us about macrolides, the crow. Macrolide drugs include erythromycin, azithromycin, and clarithromycin. There's also the newer drug fidaxomicin, which is more of a macro-like. We'll talk about how this is different from your garden variety macrolide in a bit. Macrolides work by binding to the 50S subunit of ribosomes, the typewriter, if you will, of the bacterial genome. Macrolide binding prevents translocation and brings protein synthesis to a halt. And let this jammed up typewriter remind you that macrolides are bacteriostatic, which means they stop replication, but don't kill bacteria. Well, except for fidaxomicin, which is bactericidal. Besides their antimicrobial action, there are a couple of other neat things you should know about macrolides. First, macrolides have strong anti-inflammatory activity in the lungs. Just like this snuffer extinguishes this candle, macrolides can be used to extinguish inflammatory flare-ups or infections in patients with chronic lung diseases like COPD, cystic fibrosis, and bronchiectasis. No one really knows how exactly macrolides modulate the immune system, but this property definitely makes them a useful drug to have around. Second, macrolides increase the motility of smooth muscle in the gut. In other words, they're prokinetic. So watch out for a little too much motility, or you'll be left with, well, something like this mysterious brown-colored puddle over there. Bad plumbing in these old mansions? Maybe. Anyway, check out the antiemetic sketch for more info on prokinetic drugs. Macrolides cover a broad spectrum of bugs, hence the full spectrum rainbow illuminating our scene. Coverage includes gram-positives like staph and strep, gram-negatives like bordetella, haemophilus, and even atypicals like chlamydia, mycoplasma, and legionella. And because they cover so many types of bacteria, macrolides are effective treatments for many different kinds of infections, including pneumonias, skin and eye infections, STIs, and many more.